If we can, let's talk about some of the different therapeutic approaches.
For sure.
Okay, so let's start with humanistic and just your experience with relationship building.
For sure. Well, I think I've maybe said before, and I just believe this more and more, the quality of the relationship is so important. Like so many studies say, it doesn't matter what approach you use, it's the quality of the relationship, the trust, safety, empathic caring that's there. And so it takes time, of course, like any relationship, right? So the building of the relationship will happen not right away. It's a process thing for somebody to trust you, that they can share something that they've never shared with somebody before, and it's going to be okay. You're not going to abandon them. You're going to, care for them even in their pain. So it's definitely a process that happens, and you might feel more of a bond with somebody than somebody else. If somebody is dealing with issues that are very close to yours, there might be more of a type of bond there. But that's definitely, it's definitely really important, and it's nice to have. It's nice to be able to develop that, to have that ability, right? That's something, that there's advice to give. That's generally like, what is my ability to feel, to be in relationship with people of all different walks of life, genders, races, identities.
Okay. What about paraphrasing?
Yeah, well, that's a basic skill. I've kind of noticed myself as I've kind of gone along in my career, like just different intonations. So like paraphrasing would be like, oh, so you do da 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 da. Your voice goes up. It's like a question. So you feel this way, right? And then so it's just a little thing, but I realized with myself, I'm a little more confident. I can be like, my voice goes down. Oh, okay, so you feel this way. It's a little thing, but it's as you get more confident, in your paraphrasing and being a bit more direct and less general. But
Well, I can feel the difference between those two.
oh yeah,
Yeah,
okay,
the two
right.
pitches.
Yeah. So
Yeah.
it's a subtle thing, right?
Well, the second one is it sounds like you're holding more, right? Like you're more integrated
Right.
with those skills
Yes.
into who you are and what you offer.
For sure.
Yeah.
When your voice goes down like that, it still hits the button. It progresses things more, right? Because it's like more of a concluding statement. There's more conclusion to it, then people can move on to something else. Versus like, oh, so you feel this way. Oh, okay, so you feel this way.
It
Oh,
actually
okay, so this way.
sounds like it's more like up here
Yeah, it is
in the
a lot.
mind as
It is.
opposed to being received deeply.
Totally.
Yeah.
But paraphrasing in general, of course, is like an awesome skill for beginning therapists. For clients to feel like they're heard and for you to paraphrase back, and if they feel like they're heard, that's like another step for them to be opening up more and more.
And the use of pauses.
Right. So pauses at first. I said when I saw clients at first, it's okay. Does it still look okay?
Yeah.
Just keep going. Pauses. Yeah, at first pauses were kind of like an anxious pause, because at first I was just, I was nervous, right? So a pause would happen and there'd just be like this nervous anxiety in the room, which isn't totally productive, right? There's different types of pauses. So when that happens, I would say just try to maybe say something else, right? Just don't sit in this awkwardness. But then most of my pauses that I have now are like a pause where it's like a pregnant pause. It happens so often when somebody reveals something about themselves really deeply. So it's like the contention that's happened inside themselves gets revealed, or something integrates, and then all of a sudden there's this beautiful sense of like equanimity, like something's just been healed, something that just resolved itself. And you can sit in that space for 10 minutes with the client in reverie.
So it's worth going through all of the awkwardness at the beginning.
Sure.
Can't really rush that, I guess. It's just part of the road.
It's part of the road, right? But there is two different kinds of pauses, and the second pause is it's a beautiful thing, right? It's just completely being in a state of union in the moment.
Sounds good.
Yeah.
So the psychodynamic approach. Can you speak about uncovering historical conditions?
For sure. I think it takes a while. I think a lot of people that come to my type of therapy will have some understanding of how things in their past are affecting them today. that's kind of a big part of what my therapy does, is trying to, heal the sort of lineage. Um, but yeah, I would say it takes like maybe like 3 or 4 months before clients really start to grasp it, really to understand how they're relating to people right now, and how the way they're relating to people now is affected by their past, right? The way they relate to a man now is, patterned on the way they might have related to their father. People can come in with an intellectual understanding, but actually experientially seeing it, takes some time. Um, but it can be very fruitful, I think, for people to be able to start to map and understand the trajectory of their life.
How does that drop down or change into a deeper understanding from just intellectually knowing that there was something wrong and how it's playing out in relationships, but how does that become something more, something that can transform?
Because having the cognitive understanding of it taps you into the depth of your psyche of it. It taps you into the deep emotionality of it. There's the feeling of the past in it. There's the feeling of, this has been here a long time. So the cognitive understanding, it's not just, oh, okay, there we go, I put the pieces together. There's actually a whole energetic and psychic reservoir that people start tapping into. Reservoir is a good word, right? It's like, pulls you down this big, long thing, right? Which is so much of you. So the cognitive understanding of it helps, or can be like at the beginning part, to really be able to feel the depth of your being. Does that answer your question?
Yeah.
Okay.
It's just getting into a little bit of longing there.
Sure.
Okay.
Longing for the past and how to move forward.
Longing just to, go back and revisit.
That stuff. Yeah. Okay.
It's provocative stuff. Just
So-
sitting on this side of the camera, getting involved. Okay, so next, defenses.
Defenses. Defenses are definitely tricky. You're always on the edge. I find like there's the base safety and trust of the relationship, right? But I feel like a good therapist always has, because you're always on the edge of their defenses. That's what they come to you for, is to be able to find a place where they can work through safely in the right timing their defenses. So it's a funny dynamic between being the safety and trust of here, but then there's always like a little bit of an energy, that's with their defenses. And then the timing to actually call them out and actually make it more specific has to be very careful, because these defenses have been there. Let's say you have a 40-year-old man. These defenses have been there for 40 years, and is the way he's constructed and survived. So they vary. So you have to be very wary of timing, of when to start pulling them out and looking at them, because very easily they could just shut you out really quick. And when people's defenses get really activated, things become black and white. When people's defenses are activated, there's different colors. You can smell the roses, right? The wind had whispers. When somebody's defenses get really activated, it becomes this or this. And one of the things you got to watch out for as a therapist is you all of a sudden can become this. You have all this reservoir of relationship. When somebody gets activated, you all of a sudden could be just that. So the projection, classic projection in therapy, right? So you got to be aware of that, and do it in a very subtle timing. And that's where the art of being a therapist comes in, I think.
And the need for supervision.
Yeah. Get your butt to supervision.
So do you have any other advice around that? That sounds pretty
I think I kind of
good.
That was kind of advice, maybe.
Okay.